Joining us now from Chicago is Dr. Robert Murphy. He's director of the Institute for Public Health and Medicine at Northwestern University's Feinberg School of Medicine. He's also a professor. Professor Murphy, thank you for joining us. The WHO chief just said that healthcare is not a privilege, but a right. Yet half of the world's population still lack access to essential healthcare. And I mean, we're in 2019. Who should get more blame for this current situation?
Well, there's plenty of places to point at the blame. There's many people involved in distributing healthcare worldwide. There's the local governments, there's city and regional governments, there's the big funding agencies, international agencies, and there's foreign aid. All those really come into play, and a coordinated effort really has to be done to get good healthcare worldwide.
So in the United States, for example, there's a heated debate about whether healthcare should be a privilege or a right. Many countries around the world have this public policy debate, or used to have it. Which approach do you advise, and why?
Well, the United States is the outlier in developed countries, that's clear. And that we have a health system that actually cannot be copied anywhere in the world because it's so complicated. It's so unequal and leaving many people basically with no or inadequate health care. Every other developed country has some type of guarantee of health care for all, including many middle-income countries and even some of the low-income countries. And so the United States is clearly the outlier.
And then what are some of the best practices, countries or societies around the world where they did find this sweet spot, combining the efforts of governments, NGOs, and companies, hospitals?
Right. Many countries actually do a pretty good job in coordinating the limited resources for healthcare. Cuba does a great job. They actually have health metrics equivalent to what we see here in the United States, paying a fraction of the cost. Many of the European countries also have very similar health metrics, basically the healthcare of the country, and they pay much less than the United States. Our system is completely inefficient and doesn't even reach all the people. As you probably are very well aware, where the current Republican Congress has, or the Senate anyway, and the president are trying to get rid of the Affordable Care Act in its entirety, leaving really at this particular point nothing in its place but empty promises. That's going to be a total disaster if that comes forward.
So based on your decades of research, study, experience, what must be done now to improve health conditions around the world?
Well, I think there has to be a coordination of the healthcare efforts. That's one thing for sure. And it's important to focus on the basic system that's needed to deliver the appropriate healthcare. And like I said, it can be done for much, much less than people really imagine. So it's really just a coordination and the policy that gets put in place in many countries. Rwanda, you just had a focus on Rwanda recently. They actually have a very good healthcare system. South Africa, Botswana, these countries also have very good healthcare systems. So, I mean, you can find them around the world. What you find is where the healthcare is really poor is usually where there's some other kind of conflict going on that's unrelated to healthcare, or there's just such mismanaged government that they can't coordinate the efforts that are needed.
Let's hope things will look up in the years and decades ahead. Thanks so much for joining us, Dr. Robert Murphy.
Thank you.